Next we will look at the innervations of those branches. We will begin with the long thoracic nerve, which would be this long one here. The long thoracic nerve, which is C5, C6, C7, its origins, C5, C6, C7, innervates the serratus anterior muscle. Next one is the musculocutaneous nerve, which is C5, C6, C7. The musculocutaneous nerve innervates the coracobrachialis, biceps brachii, and the brachialis muscles. It also has a cutaneous branch called the lateral cutaneous nerve of forearm. The lateral cutaneous nerve of forearm is shown here, is this part here. That and here. This is the anterior view, this is the posterior view. So it's this area here on the lateral side and a little bit on the posterior side. That there is your lateral cutaneous nerve of forearm, which is the continuation of the musculocutaneous nerve into the forearm. Next is the axillary nerve, or C5, C6. The axillary nerve innervates the deltoid muscle and the teres minor muscle. It has a cutaneous branch called the upper lateral cutaneous nerve of arm. The upper lateral cutaneous nerve of arm innervates the lower half of the deltoid muscle, so it would be this one here. And from the posterior view, you can see it here. Next is the medial cutaneous nerve of forearm and arm. Remember, we said these two here are the medial cutaneous nerves of forearm and medial cutaneous nerve of arm. C8, T1 for both of them. The medial cutaneous nerve of forearm is basically, like its name implies, medial cutaneous nerve of forearm, on the medial side of the forearm. So this half here. That was the lateral cutaneous nerve of forearm, medial cutaneous nerve of forearm. You can see the medial also here. Okay. The medial cutaneous nerve of arm is in the arm. So this part here is the arm. This is the forearm. The hand, the forearm, arm, shoulder, deltoid. So the medial cutaneous nerve of arm is right here. It's basically the medial half of your biceps there, and you cannot see it here. Next we will look at the ulnar nerve, C8, T1. The ulnar nerve innervates flexor muscles of the forearm, specifically the flexor carpi ulnaris and the medial half of flexor digitorum profundus. So here is a diagram of the hand and wrist. This muscle here is the flexor digitorum profundus. As you know, there are 4 tendons, one for each finger. The medial half is here, and this is the one innervated by the ulnar nerve. Within the hand, we know that there is 2 groups of muscles, the thenar muscles and the hypothenar muscles. The ulnar nerve innervates the hypothenar muscles, which are the opponens digiti minimi, flexor digiti minimi brevis, abductor digiti minimi brevis. Okay? Opponens digiti minimi, flexor, and abductor digiti minimi brevis. The ulnar nerve also innervates the palmaris brevis, which I have not shown here. Palmaris brevis would be in this area here, and also the adductor pollicis. This muscle here is the adductor pollicis, adducts the thumb. Finally, the ulnar nerve also innervates the 3rd and 4th lumbricals. So there are 4 lumbricals in the hand. They're attached to the tendons of the flexor digitorum profundus. The ulnar nerve also gives off 3 cutaneous branches: the palmar cutaneous branch, palmar digital branches, and the posterior cutaneous branch. The palmar cutaneous branch is the palm of the hand, right here. That's the palmar cutaneous branch. The palmar digital branches are all of this finger and half of this finger. And the posterior cutaneous branch, you can see it from the posterior view, is here. All of the posterior, including the fingers, and half of this finger. Next we will look at the median nerve. The median nerve, C5 to T1, innervates all other flexor muscles of the forearm that were not innervated by the ulnar nerve. So these include the pronator teres, the flexor carpi radialis, the palmaris longus, flexor digitorum superficialis, flexor pollicis longus, the lateral half of flexor digitorum profundus, and the pronator quadratus. Within the hand, we said that the hypothenar and the adductor pollicis muscles were innervated by the ulnar nerve, as well as the third and fourth lumbricals, which are not shown here, which means that whatever is left is innervated by the median nerve, and those are the thenar muscles, which include the opponens pollicis, flexor pollicis brevis, and abductor pollicis brevis. The lumbricals innervated by the median nerve are the first and second, not shown here. The third and fourth are innervated by the ulnar nerve. So one more time, the thenar muscles, abductor and flexor pollicis brevis, opponens pollicis, and the first and second lumbricals. The median nerve gives off two cutaneous branches, the palmar cutaneous branch and the palmar digital branch, just like the ulnar nerve. However, as you can see, there is no posterior cutaneous branch. The ulnar nerve had one, the median nerve does not. So the palmar cutaneous branch and the palmar digital branches are here. This is the palm, the palmar cutaneous, so it would be this part here, including the finger, the thumb, but not this area here. And the palmar digital branches are these fingers here, and half of this finger. The other half is the ulnar nerve. Because the median nerve does not have a posterior cutaneous branch, there is no innervations of the posterior hand by the median nerve, just the palmar side.